Okay, so I've been getting some questions regarding the difference between myelopathy versus radiculopathy. And so, in order to understand the signs and symptoms of these two different things, we have to understand what's actually being affected. And so, this is an example of a cervical spine CT. And what I'm going to show you here is basically the bones in the front and the bones in the back, and separating the bones in the front of the intervertebral discs. And then down the middle here is the spinal cord. Okay? And this is if I'm looking at somebody from a side profile. And if I were to draw this a little bit differently, if we were looking at somebody from the front, what you would see is the spinal cord coming down, and off of the spinal cord are the nerves that are branching off, like this. And that goes on and on all the way down the spine. So it's just a segment here I'm showing you if we were looking at somebody again from the front. So down the middle here is the spinal cord, and then the nerves coming off of the side on either side. Now, in myelopathy, what's happening is that the spinal cord itself is being injured. And I'm not going to go into any of the specific pathologies of what cause a myelopathy, because there are many, many. But what I'm going to do is go into the difference between the symptomatology that you would see in somebody who's myelopathic versus somebody who is radiculopathic. And so, in myelopathy, I like to think of a little bit of an analogy. And so basically, you can think of the brain as the parent, okay, and the cord, the spinal cord, as the child. Okay, and the brain is sending impulses down towards the spinal cord, and basically the brain's job, or the parent's job, is to discipline the cord or the child, right, and keep it from going crazy. So basically, when there's pathology in the spinal cord at a particular level, what happens is that those impulses are no longer going to make it down into the spinal cord, and what happens is that the cord becomes overreactive or hyperreactive, and that leads to the symptoms that we see in somebody who is myelopathic. So those symptoms include things such as brisk reflexes, okay? And brisk reflexes can take numerous different shapes and sizes. One is clonus, okay, which is actually a video example of that on our channel. Another example is a Hoffman's reflex, okay. Another example is a Babinski, okay, or a plantar response. And as well as just brisk reflexes when you test the reflexes by tapping on their tendons. Secondary, and also seen in patients who are myelopathic, is spasticity. And spasticity is a result of the lower motor neurons that are present in the spinal cord are not receiving that inhibitory signal from the brain as well. So spasticity of the muscles that those lower motor neurons innervate results, and spasticity can take several different forms in terms of physical exam, and one is often manifested as gait dysfunction, so people come in and have difficulty walking secondary to their spasticity. In addition, bowel and bladder spasticity can occur, and that can lead to incontinence, and nobody likes that. And then finally, you can see patients can be quite clumsiness. So one of the more common complaints is that people with myelopathy have difficulty using utensils, or they notice that their handwriting is becoming more difficult to interpret because they're having trouble holding a pen. And finally, you can also see changes in sensation, okay? Because remember, the sensory pathways are also running up the spinal cord as well, back to the brain. And one of the things you can sometimes see is what's known as a Lermitz sign, and that occurs when the patient flexes their head forward and they get this kind of electrical shock-like sensation down their spine, sometimes into their extremities, and that's a result of the cord, the sensory components of the cord being affected. So how does that so how do those symptoms and signs of myelopathy differ from a radiculopathy? And in radiculopathy, what's going on is that the nerve itself is what's being affected, so the nerve coming off of the spinal cord. And in radiculopathy, those nerves specifically are going to specific areas of the skin where they're supplying sensation, and in specific muscle groups, right? So depending on which nerve is involved, a very specific or dermatomal pattern of changes in sensation is going to occur, such as numbness, tingling, loss of light touch, things such as that in a very specific pattern. And same thing with the muscle group. So specific weakness related to a particular muscle will also occur if this nerve is being injured in some way. So that's the difference between myelopathy and radiculopathy. It's important to realize that patients may present with signs and symptoms of both in a condition known as, of course, myeloradiculopathy, depending on if the pathology is injuring or compressing both of the neural elements, both the nerve roots and the spinal cord itself. So sometimes it could be a little bit difficult to tease out what exactly is going on.